Oral Health and Endocrine Function. Insights from 2025 Research Abstract. Emerging evidence from 2025 underscores a compelling bidirectional relationship between oral health, principally periodontal disease, and oral microbiome imbalance and endocrine system disorders, including diabetes mellitus, thyroid dysfunction, metabolic syndrome, and obesity. Mechanistic pathways involve shared genetic susceptibility, systemic inflammation, microbiome endocrine signaling, and hormonal modulation of the oral niche. 1. Periodontitis and diabetes mellitus. A TWOE relationship. Contemporary scoping and genetic studies confirm a robust bidirectional association between periodontitis and type 2 diabetes T2D. Frontiers in Endocrinology 2023 emphasized how chronic periodontal inflammation exacerbates glycemic dysregulation and insulin resistance, while T2D increases susceptibility to severe periodontitis and related complications. Frontiers, a genome-wide cross-strait analysis 2024 revealed significant shared genetic architecture, global genetic correlation Springerlink. These findings underscore genetic pleiotropy as a key mediator of disease occurrence. 2. Obesity, lipid metabolism, and hormonal factors. A cross-sectional study published in BMC Endocrine Disorders linked obesity, dyslipidemia, and periodontal status, elevated BMI, waist-hip ratio, and especially triglyceride levels, or 3.1 strongly correlated with periodontal disease severity, pro-inflammatory adipokine profiles, for example, high leptin, visfitin, and low adiponectin. Also paralleled periodontal damage, suggesting endocrine immune microbiome interplay and pathogenesis. Springerlink, another scoping review within military medical research, highlighted associations between metabolic syndrome and periodontal disease, noting a dose-response relationship between periodontal severity and endocrine or metabolic risk, though some studies showed heterogeneity by gender and study design. Arxiv 15 Biomed Central. 15 PubMed 15.3 Thyroid Dysfunction and Periodontal Health. A pivotal scoping review in INT-J EnvironRay's Public Health published early 2025 examined the bidirectional association between periodontitis and thyroid disease, including hypo and hyperthyroidism. Thyroid dysfunction was associated with increased periodontal inflammation, delayed tooth eruption, taste changes, and salivary gland enlargement, while periodontal treatment improved thyroid hormone parameters, in some cases episystemic inflammation, genetic predisposition, and oral microbiome dysbiosis are hypothesized mechanistic links for hormonal modulation of the oral microbiome. Hormones present in oral fluids significantly influence oral microbial communities. A 2025 review PubMed highlighted that steroid hormone fluctuations during puberty, menstrual cycles, pregnancy, or endocrine disorders can shift microbial compositions, creating niches favoring disease-associated taxa. Remarkably, certain oral bacterium metabolize host steroid hormones, thereby disrupting endocrine feedback, implying bidirectional or allendocrine communication. PubMed 5 Mechanistic pathways connecting oral and endocrine health. Inflammatory mediators. Periodontal disease elevates systemic cytokines IL-1, TNF, CARP, which may impair insulin sensitivity, disrupt lipid metabolism, and interfere with thyroid signaling pathways. PMC Biomed Central. Microbial translocation. Oral bacteria and their antigens can access circulation oral bluedaxis, promoting endocrine dysfunction and metabolic dysregulation, including insulin resistance and dyslipidemia. PMC Biomed Central. Shared genetic susceptibility. As demonstrated by GWAS analysis, pleiotropic genes influence glycemic control and periodontal resilience, providing a molecular basis for comorbidity prevalence beyond lifestyle or BMI factors. Springerlink. Hormonal modulation of oral niche. Endocrine changes modulate oral immune responses and microbial ecology, for example, estrogen or progesterone in thyroid disease, potentially exacerbating or ameliorating periodontal inflammation. PubMed 6 Clinical and public health implications. Interdisciplinary screening. Endocrinologists should consider periodontal evaluation in patients with diabetes, metabolic syndrome, or thyroid disease. Conversely, dentists may flag systemic endocrine risk in individuals with severe periodontal disease. Lifestyle and dietary interventions. Anti-inflammatory dietary patterns such as Mediterranean diets, rich in monounsaturated fatty acids, may support both periodontal and metabolic health by modulating adipokine profiles and reducing cytokine-mediated systemic inflammation. Reddit 13 Biomed Central 13 Frontiers 13 Biomed Central 2 Reddit to Springerlink 2 Therapeutic hygiene and endocrine outcomes, scaling and route planning in periodontitis has been associated with modest improvement in glycemic control and possibly thyroid hormone regulation, supporting integrated oral endocrine care pathways MP7, research gaps, and future directions. Human intervention trials are needed to establish causality, e.g., whether periodontal therapy can significantly reduce HbA1c or modulate thyroid function long-term. Detailed microbiome studies should explore how hormonal states, for example, hypothyroidism, shift oral microbial ecology toward pathogenic profiles. Genomic and transcriptomic research may further elucidate pleiotropic pathways linking endocrine traits and oral inflammation. Nutritional intervention studies should test anti-inflammatory diets as dual modulators of endocrine and periodontal health. Conclusion: the 2025 evidence base strongly supports a bidirectional oral endocrine axis, with periodontitis influencing endocrine disorders, diabetes, thyroid disease, metabolic dysfunction, and endocrine states modulating oral microbial ecology and periodontal disease severity, shared inflammatory, microbial, and genetic mechanisms. Mediate these interactions. Integrating dental and endocrine healthcare, advancing microbiome and nutritional research, and implementing interdisciplinary screening protocols will be essential for holistic disease prevention and management.